experiences they'll certainly have at other locations. I just want to give you a little bit of background before we have our chairman of the task force being here. Of course, the National COVID-19 Vaccination Operationalization Task Force was appointed in September 2021. The task force comprises proven, results-oriented Jamaicans of high regard and integrity, and it's an independent body which will liaise with the Ministry of Health and Wellness and the private sector to scale up and streamline the national vaccination program. Already, we've seen some results. An expansion of vaccination sites across every parish in Jamaica, well over 200 sites available for Jamaicans to utilize, house-to-house vaccinations, and a more inclusive and targeted approach to the vaccination messaging, and certainly more to come. Of course, this is to ensure that Jamaica emerges stronger and more resilient and quickly from COVID-19. Remember that COVID-19 is not a Jamaica-specific virus. It is a pandemic. Every country across the world is facing some of or even more harsh realities than we are in Jamaica. And so how long Jamaica responds and how well Jamaica responds will determine how we emerge from COVID-19. The chairman of the task force appointed by the Prime Minister, the Most Honorable Andrew Holness, is Professor Gordon Shirley. Professor Shirley is a results-oriented Jamaican. He is president of the Port Authority of Jamaica. He joined the Port Authority of Jamaica in 2013 on secondment from the University of the West Indies. Along with Professor Shirley on this August body, we have Mr. Dunstan Bryan. Mr. Bryan is the permanent secretary in the Ministry of Health and Wellness, and he brings with him a wealth of knowledge and experience from working in the public sector for more than 2 decades and with international development partners, including the World Bank and the Inter-American Development Bank. Along with Professor Shirley and Mr. Bryan, we have the country's chief medical officer on board. Dr. Jacqueline Bisesa McKenzie has 25 years' experience in healthcare in Jamaica and was the first emergency physician to be appointed as a consultant in the public sector. Dr. Sheila Campbell-Forrester. Dr. Campbell-Forrester is a former chief medical officer in Jamaica and a regional director for the Western Regional Health Authority. She was recently appointed member of this task force and a member of the Friends of Mental Health Committee. Presently, Dr. Campbell-Forrester is the president of the Caribbean Adolescent Association for Health and advisor to the Duncan Tree Foundation. She's also a lay pastor of the Montego Bay Mount Ward Circuit of Methodist Churches. With us today at the banquet hall here at Jamaica House, we have Mr. Peter Melhado. Mr. Melhado, who is also serving on the COVID task force, is the president and CEO of the ICD Group, a Jamaica-based conglomerate with interests in real estate, construction, property management, general insurance, and business process outsourcing. Online, we have with us Professor Lloyd Waller. Professor Waller is a professor of digital transformation policy and governance in the Department of Government at the University of the West Indies, Mona. His primary areas of research and expertise are advanced research in methodologies, digital transformation, and tourism resilience. Thank you, Professor Waller, for joining us. Here at the banquet hall, we also have with us the man in uniform. He is Colonel Markland Lloyd. Brigadier, I beg your pardon, now Brigadier. Congratulations, sir, and thank you so much for joining us here. Brigadier Markland Lloyd. He's currently the acting commanding officer of the 1st Engineer Regiment, or you've gone way up past that. As Brigadier, you are in the upper echelons of the Jamaica Defense Force. Thank you so much, Brigadier, for joining us. You were promoted recently to serve in that area. And finally, with us this morning, we have Mr. Alok Jan. Mr. Jan is the managing director, well, former trans consultant in Asia, and he worked certainly in the accounting sector. Mr. Jan is now a senior consultant in the government of Jamaica. And so we're thankful to have all the members, the distinguished ladies and gentlemen who will serve on this COVID-19 task force. It's been a while. They had to spend some time understanding all issues relating to our vaccination program, and of course, working behind the scenes to ensure that all the I's are dotted and T's crossed. Well, this morning we're pleased to hear from, for the first time, the chairman of the task force, Professor Gordon Shirley.
Thank you very much, Ms. Francis. It is my distinguished pleasure this morning to be able to address you on behalf of a group of colleagues that I have enjoyed working with. I've known them professionally, but they have taken to this task with a great degree of commitment, and I'm grateful to them for doing so. I'll be using a slide presentation to share with you the work that we have done, the approaches that we have utilized, and the recommendations that we have made. We are pleased to see that a number of the recommendations have already begun to be implemented in practice, and we hope that many more of them will be taken up as well. Let me begin by looking at the roles and responsibilities of the National COVID-19 Vaccination Operationalization Task Force. Quite a mouthful. The remit of the task force are: one, to optimize the operational and logistical aspects of the vaccination program from end to end. That is, from appointment making to queuing and walking, all the way through to the vaccination and post-vaccination information collection and management. A second, and our objective there is to assist the Ministry of Health and Wellness by providing some suggestions for how that might be enhanced. Our second mandate or remit is to develop and oversee the implementation of recruitment strategies for doctors and other health professionals to expand the number of persons who are available for the national vaccination program. A third is to meet with and encourage various sectorial groups to participate in the national vaccination program and to oversee the administration of public-private partnerships to administer vaccines. And so, in this regard, we have been working quite closely with the private sector vaccination initiative on a number of projects, and we are very pleased to see again that some of those are being implemented as we speak. We have a responsibility to create a national dashboard, and finally, we have the responsibility to facilitate the implementation of an unambiguous authentication system for vaccination, building on the Ministry of Health's database. In doing the work of the Commission, we have had to meet with a number of entities, persons and entities, and have benefited enormously from the interchange, from the interaction, the ideas exchanged. And so I want to underline that the recommendations that we make, we don't necessarily claim authorship for all of these. We have discussed these with many other persons, and where we have seen ideas that we think are relevant to the national effort, we have embraced them. Who are some of these entities that we have met with? The leadership of the government and the opposition would top that list. We report to the most honorable Prime Minister, and so we meet with him on a regular basis to update him on our recommendations. We similarly meet with the Minister of Health and Wellness, to whom we also report, and he receives the reports as we prepare them. We have met with the Leader of Opposition and several members of his shadow cabinet. We have met with the opposition spokesman for health and other members of his team. We have met with the leadership of international COVID-19 task forces. So, for example, we have met with the chair and the members of Ireland's high-level task force on COVID-19 vaccination, and we have met with the leadership team of the National Vaccination Initiative of the Dominican Republic. And what is interesting about meeting with these international entities is that in the case of Ireland, for example, let's say a more developed nation, they were able to orchestrate the entire vaccination program on the backbone of their national health system. In the case of Dominican Republic, closer to our economic situation, they decided to leave the health system as it was, to focus on the things that it was established to do, and established a parallel track, bringing on persons who would do the vaccination, the entire gamut, and they participated in partnership with the private sector. So different models, different things that we can learn from having spoken to them. We've also met with the private sector leadership, the leadership of the PSOJ, the Manufacturers and Exporters Association, the JCC, the Private Sector Vaccination Initiative, the Micro, Small and Medium Size Alliance, the Tourism Vaccination Initiative, and we have met with the chairman and CEOs of several leading private companies. In the health area, obviously we meet on a regular basis with the permanent secretary and communicate frequently with the CMO and their team, but we have also met with the Junior Doctors Association, we have met with the Medical Association of Jamaica, the Nurses Association, the regional health authorities, speaking to the chairpersons, but also the regional directors and the medical officers of health, the public health, and a variety of public health experts, including former CMOs and heads of regional agencies. And we have met with system providers, including the providers of the vaccination authentication system, which we will discuss in a moment. Next slide, please. So the first question we began by asking is, how is Jamaica doing? And we have frequently updated this information, although the pattern hasn't really changed. This is about less than a week old. And what we have here is a share of population that is fully vaccinated against COVID-19 in the left panel. And it ranks the countries, our trading partners, and the countries with whom we do business but also compete in the region. So at the top, you see Cayman Islands with 84% vaccination rate. Turks and Caicos below them, you see Cuba, you see Panama in the 50s and 60s, Antigua and Barbuda. Dominican Republic, I mentioned that we spoke to their team, is at close to 50%. Trinidad at 40%, Barbados at 40%, Mexico at 38%. And then the world as a whole is at 38.4%. Below that, we have Dominica, Bahamas, Grenada, and then we come to Jamaica. Jamaica is at 11%. The only country on the map below us is Haiti at 0.25%. Even if we change the picture and look at the persons who have received the first dose, the percentages change, but the pattern is still essentially the same. Cuba heads that with over 85%, and at the bottom we see Jamaica at 20%. The final slide on the chart on the map really looks at vaccine doses administered per 100,000 persons, but the message is essentially the same. The next slide looks at the vaccination by type and dose over time. And the dotted lines are the pattern for the first dose, and the solid lines for the second dose. And interestingly, you'll see that the first peak occurred when we got the first big batch of of AstraZeneca. You notice it's not matched by an equally large spike. And we anticipate that in that process there are some persons. We know that there are close to 30,000 persons who have not returned to get a second dose. And there are many reasons why that might be so. But you'll notice that the pattern in the later periods, you see a pattern which is mapped on the first dose, looking very close to the ones on the second dose. But let's go to the bottom slide. What you see there is a daily vaccination demand for single doses. And what is of concern to us is if you go to the far right of that diagram, you will notice that the rate of Jamaicans coming for first doses has fallen quite substantially. And so today it's about 1,600 that are coming in for their single dose. Given that we are at just about 12%, it's going to take a long time to get all Jamaicans vaccinated unless we can change that pattern. So what are the immediate problems? The immediate problems include the following. Supply continues to outstrip demand, resulting in suboptimal utilization. And there's an observation I want to make about this, which is that if we went back 6 weeks ago, 6 to 8 weeks ago, we felt that the real problem was a supply problem because there was a groundswell of demand that was out there, and we felt if we just got the vaccines, everybody would get vaccinated. Now we have a relatively good level of vaccination, and the demand we recognize is not materializing. The persons who were willing to come forward have in fact largely been vaccinated, and now we are into those who are hesitant. And the surveys that have been done indicate that up to 65 to 70% of the population is hesitant. We also have determined that all vaccinations are not perceived as being equal. So when the Pfizer vaccine was introduced, there was a spurt of demand, which has tapered off ever since the Pfizer has become unavailable. Another major problem is that the frontline workers, excluding the JDF, have very low vaccination penetration rates. Public health nurses, for example, have a vaccination rate of less than 50%. A major problem is that schools are still out. This is a national crisis in education which continues to deepen with the threat of irreparable consequences for a whole generation of students. Many students in Jamaica have had reduced levels of instruction for over a year and a half. In some cases, no instruction for a year and a half. That is something that the nation is going to pay a price for down the road, and we have to resolve that very quickly. The healthcare administrators and workers have become worn down by the protracted crisis. And there's an increasing concern exacerbated by the situation as it relates to the AstraZeneca vaccines, some of which were dumped last month, and there continues to have to be some dumping of the vaccines. So how do we fix these immediate problems? I'm going to go through a number of strategies because there's no one magic bullet. There are a number of things that we have to do, and they have to be done largely in parallel. So the first is that we need to decentralize the process of vaccination and take the vaccination to the citizens. We need to decentralize the vaccination process to give the regions and parishes more autonomy, to train and encourage more players to participate, including the private doctors, and to increase the mobile field forces to target the low coverage areas. And we are pleased to say that the Ministry of Health has begun to implement, I think, all of these strategies. As a large organization, it takes time to pivot, but we anticipate that they are going to move aggressively in the future in trying to expand this. The second aspect of it is that we need to refocus on the most vulnerable. We need to use the population data to target those persons who are over 60 years old and to leverage the National Health Fund's database to reach out to those who are in the comorbid cohorts. The over 60s make up 13.5% of the population, but they account for 73% of the COVID-related deaths. That's at 350% of the national average. Less than 35% of them are vaccinated with at least one dose. That has important consequences. Although we have the 35 is the largest cohort, the largest age cohort, the largest vaccination rate among age cohorts. In most countries, if we look at Ireland, they were early in getting that into the high 90s. They came out and got the vaccination. And that has been important in keeping their hospitalization rates at the lower end. If we begin any opening of the economy and we don't deal with the most vulnerable, we're going to continue to have a problem where our hospitals are crowded out by the presence of persons with COVID, the COVID disease from this cohort. So it's very important that we get to them, and we think that we have some information through the National Health Fund that would help us to get to that, as well as the other population data. Thirdly, we think we need to increase the flexibility and efficiency of the system. We have done work and have presented information to the Ministry of Health on an end-to-end vaccination process, highlighting various ways in which we think we could simplify the process, particularly the vaccine custody, and to reduce the site overlay to make the system more efficient. We also think that attention is going to have to be paid on the vaccine interchangeability policy. The next item is to vaccinate the healthcare workers as a matter of priority. We think it's very important to do so. We think we have lost more public health nurses and healthcare workers than we ought to. Is that the one? We have lost more healthcare workers and public health nurses than the country ought to. These are persons who have put their lives on the line for the country, and we respect and honor them for having done so. But it would be great if we also are in a position to protect them, to give them the highest level of protection that's available. As it stands, as I mentioned earlier, only 50% of our public health nurses are vaccinated, roughly. It's also a particular problem because public health nurses are one of the most trusted sources of information on medical matters throughout Jamaica, particularly in the rural areas and in our inner city communities. The public health nurse is their go-to person when they are ill. It is that person who they trust to give them the right medication, to give them the right advice. And we all know that Jamaica is sensitive. They can pick up just by looking at you and looking at the inflection of your eyes and your body language, whether you really are in support or not. And we think that this has an important role to play in many groups, and certainly among the most vulnerable. We think also that the public health nurses' vaccination has potentially cast a pall over the national vaccination program, which would be removed if we were to be able to improve the vaccination rate. So how do we do that? We think that we should implement a program that has specialist doctors in a variety of areas to address the concerns raised by the nurse. And so in speaking, for example, to the Nurses Association, we know that many nurses who are of childbearing age continue to worry about their reproductive health. So the best way to do that, they are healthcare workers, is to get gynecologists who they trust, to explain to them in terms that they will understand what are the issues and what are the risks associated with that. Others worry about the implication for their various other illnesses. What we think we need are specialists who will speak to them both in large groups as well as in smaller groups and on a personal basis about these problems to get them to move along. We cannot continue to allow them to put their lives on the line and not do the best we can to protect them. after a sufficient period, we believe, of effort, we believe that we have to implement a vaccinate or test program for the healthcare workers and the nurses. We believe that the government should support the cost of testing for a few weeks, after which the healthcare workers will have to assume the cost for doing it themselves. And continuing in this vein, we think I've mentioned to you how serious the education problem is. The protracted school closure poses a great existential threat to our nation. It's a huge problem, and those countries that I showed you up front, who are way ahead of us, their children are going to be better prepared when they get to the job market than will our children. Jamaicans are great, but you still need your education to be able to compete in a global context. And we think that that has to be addressed. We think that there has to be a program that is focused on the schools, and when we go back to school, we think it's very important to protect the teachers, but also to protect the students by ensuring that our education the forces, our employees in the educational system, the administrators and the teachers also become vaccinated. And we propose that be an area in the public service that we would want to focus a vaccinate and our test program. We think that the other frontline workers, like the JCF, and the other uniformed forces like the fire brigade, these are critical frontline workers that have to interface on a day-to-day basis with the public. We believe that they should follow in the footsteps of JDF. In this case, we understand a vaccination rate of over 90%, which is, we think, probably one of the highest in the country. We think that there are other private sectors that we need to have a concerted effort. In tourism, for example, tourism has been the most open of our sectors and have restarted. But in many cases, the tourism vaccination rates, in spite of programs with the private sector vaccination initiative, have leveled off in the 50s and 60%. There are, of course, instances where you will get a hotel with 90%, but on average, they are in that region. In the cruise industry, for example, now that we are opening up, the Ministry of Health has said that the employees at all attractions should be 100% vaccinated. That's going to take a lot of effort to get there, but we think that that is something that the sector has to put its mind to, and to collaborate with the Ministry of Health as best as we can to get as close as we can to those targets. That it's in the interest of both the individuals who serve in that sector and their families that they are vaccinated if you are going to be exposed to persons who are coming in. Even though the persons who are coming on the cruise ships are going to be largely vaccinated, we still have to protect our workers, our employees in those sectors. The BPO sector is another one which competes internationally, and our vaccination rates are much lower than those of our competitors, and we stand to lose business because of this. We need to set a timeline for the vaccination or test program. We recommend that in the case of the public sector workers, just like we mentioned with the healthcare workers, we believe the government should support the program, support them for a while, but then the workers eventually go on their own. We emphasize that in all cases. We emphasize in all cases. I'm sorry. Okay. We recommend that in all cases the companies involved, whether they be public or private sector, undertake a strenuous process of educating the workers, of trying to understand the source of their hesitancy, in providing support in overcoming that hesitancy, and as much counseling as is necessary. We believe that that's an essential part of the process, whether you're in the private sector or the public sector. But we believe too that the managers and the the executives in those organizations need to take into account the public responsibility they have, both for their workers and the entities that they come in contact with. We need to address the AstraZeneca problem. We're almost at the end of October, but it's not the end of the problem. We recommend that we use the ComCare data to identify and encourage the 65,000 or so citizens who have not turned up for their second dose of AstraZeneca. We think that we could refer to that as a low-hanging fruit because they took one already, and to be fully vaccinated, they need a second. We think we need to allow citizens the flexibility to take doses a little earlier than their actual due date and not turn them away. And we have spent some time talking to public health experts on this, and they support the fact that if you have the vaccines, if the vaccines are going to go to waste, it will be better to allow persons to come in a little bit early and take their shots. The work with the private sector vaccination initiative has borne fruit, and the Ministry of Health is onboarding a number of private doctors. The target is to get up to 200. Our interaction with the Medical Association of Jamaica is that we could even exceed 200 with a little bit of luck. And that would expand considerably the number of persons involved in the delivery of vaccination, the vaccination process. We believe too that those persons, because they would be administered in the privacy of their offices, would offer a very different environment from the clinics and the bigger sites, because the doctor has a one-to-one interface with the individual, and the process of answering their concerns and questions is going to be of an order of magnitude different from in the public environment. We believe that we have to devise a workable logistic framework, and the PSVI has been working with the Ministry of Health on doing that. We need to simplify the vaccination process requirements, and work has been done on that by the Ministry of Health. We need to ensure that an acceptable legal indemnification agreement is in place. It is important to note that the doctors coming on board is not just because the vaccines are expiring now, but they will be available throughout the vaccination process. So there's a net win in that regard. We have been asked to work on the vaccine authentication process, and some of our colleagues who are here with me have done quite a bit of work on that. Any large-scale vaccination process needs a number of systems working seamlessly with each other, from appointment systems to the systems which manage the data that is inputted, as well as at the back end, the authentication to ensure that people who want to know whether or not you have been vaccinated can get a trusted mechanism to do that. The task force, in collaboration with the Ministry of Health, has received several expressions of interest from a number of international and local teams offering authentication systems. Fact-finding meetings were held with these entities, and our focus was primarily on identifying the digital certification system for domestic use, as well as the overseas travel using the WHO or EU protocols. Cabinet has approved an engagement with eGovernment India, which is a not-for-profit organization based in India, to implement their DIVOC software platform. What are some of the key technological features of this platform? It is open source, so there are no license costs or proprietary intellectual property concerns. It's scalable and highly secure. It's fully application program interface based, and therefore is easily connectable with ComCare. It's deployable on any cloud platform. It has the capability to expand to other immunization programs. So any of our child care or any other immunization program that we are doing in the country can be dealt with on this platform. It allows secure access by third-party apps. And we think that Jamaica will want to develop a government app, as India did, that allows cryptographic verification via a QR code for a wide variety of verifiers, including restaurants and offices and public facilities and so on. The time frame for implementation, DIVOC indicates that the typical implementation is 5 to 6 weeks from engagement, assuming access to the application programming interfaces. The integration support that would be required, DIVOC would provide all the initial resources for integration, and Jamaica would likely need to build internal capacity to support the platform or contract a third party to take on this role, which could be a local third party. And the next steps are to begin the technical discussions with e-Government India to plan the integration approach. And my colleagues are already hard at work on this with e-Government India, and to procure the additional hardware to host the DIVOC system. So I turn now to look at the communication issues. We need to fix the communication issues with Jamaicans. We need to listen more carefully to the various concerns of different groups of Jamaicans. We need to respond to their needs. We need to understand where there are gaps in the information available to them that leads them to be uncertain and unsure. We need to understand the barriers and motivation, and we need to understand their preferences for the channels through which they get their information. We need to give clear information for informed decisions, delivered in a relatable language and using trusted voices. We need to use the currently established social networks to engage with citizens at all groups. And these include our communities, the SDC officers, our churches, RADA for the farmers, the entertainers, the athletes and the sports clubs and the coaches, the JTA and the school boards for the teachers, the soldiers, the doctors and nurses, and the social clubs. All need to be contacted and to become a part of the process. We need to fix the communication, the issue of misinformation. We need to combat misinformation. We need to determine the information sources that are putting out incorrect information, identify a fact-checking team to address the emerging misinformation and present honest alternatives. We need to make experts available to the media, to provide deep briefing if necessary, and to have the quality content placed in the hands of Jamaicans, presented by voices that they can trust. We need to also do a couple of other things. We believe that there's an opportunity to leverage the machinery of the political parties to get vaccines into arms. We believe that a well-organized and coordinated bipartisan effort could yield great value in this regard. One which would focus on all constituents, but would give an emphasis to those who are most vulnerable in those communities, who would find it difficult without the kind of support that this machinery would allow us to bring out. We think that it could demonstrate a whole-of-country approach to the problem by working across political parties, but also dealing with the urban-rural differences that exist. We believe that there's great opportunity in pursuing this route. We believe also that it is now time to have a proof of concept. There are many Jamaicans, there are 12% of us, 20% have taken one dose, who have made an investment in the future, and we think they should be rewarded. We believe that there's an opportunity to organize well-structured, monitored events for groups of people within different classes of Jamaica. For example, an event at the National Stadium where persons who are already vaccinated can gain access to the event, and persons who are not yet vaccinated can come up to the stadium, get vaccinated, maybe the one-shot vaccine or whichever their preference is, but gain access, maybe in a different section of the facility, but would be able to participate the way we used to participate. And there are a number of events coming downstream soon that would lend themselves to that kind of activity. And one of our members is working very closely with the entertainment community and the sporting fraternity to try to bring that to reality. But we also believe that even smaller events, Christmas is coming. And many Jamaicans look forward to a staff party and a Christmas party. We believe that there are opportunities to allow persons who have been vaccinated to begin to return to a level of normalcy that would be associated with events such as those, and Christmas would be an ideal time to have it done. We finally believe that it is necessary for Jamaicans to be honest with this and accept that there's a possibility of COVID-19 being with us for a much longer time. The vaccination is the first phase, but there are many variants that are coming, and we have seen in other countries those who thought they had gone past it are now having to reintroduce certain measures. So we think we have to normalize our society for COVID and open up. We believe that once the key short-term objectives have been met, we need to open the economy. If the key economic sectors have been vaccinated, if the key public sector entities have been vaccinated, if a high percentage of those over 60 and the persons with comorbidities have been vaccinated, if the healthcare centers are strengthened and access remains high, then we think the economy should be prepared for reopening. We think even while we focus on the messaging to get persons out, we have to think about broadening the message to include the fact that it's important for every Jamaican to continue to improve and strengthen their immune system. You get this disease in much the same way we get flu. We need to ensure that we are promoting the adherence to the protocols while encouraging behaviors that strengthen the resistance to contracting variants, which could be even more debilitating than the ones that exist. We need to, we think, also establish permanent standalone COVID-19 facilities in the regions. Why? Because it's important to get the hospitals, our hospitals, back to focusing on what they were doing before. Jamaicans are still getting ill. Jamaicans are still needing various surgeries and other reasons for being in the hospitals. They are being crowded out by COVID. And it's important that we are able to do both. We believe that we need to begin to measure the number of persons with COVID-19 antibodies. You get antibodies through the vaccination process, but you also get antibodies through having contracted COVID and recovering from COVID. And we think that it is important to monitor the persons who have recovered and who have natural antibodies. The total is a better measure of the ability of the country to cope with the disease. And we have begun to work with some of our eminent scientists to think about how that might be done and to get it done. And then finally, we think that we should seize this particular moment in Jamaica's history to transform our health sector. We believe that it is an opportunity to change the legislation to create a modern, rational, efficient health sector. We believe that it creates an environment to negotiate the necessary changes with the current healthcare professionals and their unions. We need to incentivize the creation of appropriately equipped modern health facilities. We need to seize the opportunity to become what we know we have the capability of being, which is the health center, the healthcare center for the region, and to create potentially a competitive income generating sector for Jamaica, building on the health education system in Jamaica, which is unparalleled in our region, and the local and international human capacities that we have accumulated. So we think that while we address the short-term issues, we still have to keep an eye on the longer-term issues. I've shared with you a range of activities that we think they all have to be pursued in parallel. We are grateful for your listening ear, and we'll be happy to take any questions that you have at this time. Thank you, ladies and gentlemen.
Thank you, Professor Shirley. A very comprehensive approach to the methodical way in which the task force has gone about doing its work. Looking at diagnosing and analyzing the problem, then finding solutions, practical and scientific approaches that you've outlined, looking at Jamaica in all its various facets and the dynamics that make up Jamaica and Jamaicans, and of course, talking a little bit about public education program, ensuring that worker education is critical, counseling as a major part of it. Thank you so much for that. And of course, a very important part, the vaccine authentication system, looking at timelines. So this is not just a task force that may be making recommendations, but you're certainly holding persons to task for that, looking at the gaps and barriers, clear information that must be given to combat misinformation, looking at a whole of country approach, critically a blueprint to reopening the economy, very, very critical, and of course saying that we must as a country seize the moment and improve things and systems in terms of ensuring that Jamaica, recovers stronger out of COVID-19. So very comprehensive there from Professor Shirley. Thank you so much, Professor. May I welcome as well those joining on Nationwide 90 FM who would have listened through Professor Shirley's presentation. And now we ask members of the media who have joined us on our Zoom platform, if you do have questions, you would have been promoted to a panelist. We ask that you use the raise hand feature. And then once you raise your hand, and I see you, I'm actually on the Zoom platform here on my phone, my gadget here. Once you raise your hand and I acknowledge you, ask if you would be so kind to just tell us your full name and the media entity you represent, and of course ask your question. I ask that, given that you may have several questions, that you allow Professor Shirley and the members here to be able to answer your questions and not forget. So maybe you'd want to limit it in the first instance to 2 questions per person so that we can follow the questions and answer as best as possible the questions. So I am looking on, I see all those from the Gleaner Company, JIS, the Jamaica Observer, Nationwide 90 FM, RJR, online, not seeing any hands up as yet in terms of questions. Thank you for your comprehensive report then, Professor. May I also note that we have online with us 2 members of the task force. That is Professor Lloyd Waller at the University of the West Indies, and of course, former CMO, Dr. Sheila Campbell Forrester. Thank you so much. Couldn't be with us in person, but they're also available online to respond to any questions, along with Professor Shirley, Mr. Jan, Brigadier Lloyd, as well as Mr. Melhado, who are in here with us at the banquet hall at Jamaica House. So let me then acknowledge Mr. Renardo Brown, who is on our Zoom platform, who will have a question for the task force. I will take my leave from the podium, allow Professor Shirley or any other member of the task force to respond. Mr. Brown.
Thanks so much. I do hope that you can hear me. Good morning to everyone. My question is sport-related, and I do hope that the panel can answer. As it relates to sports, what exactly needs to be put in place to allow fully vaccinated persons into sporting events? And is it different from events that are not sport related?
Brigadier Lloyd will respond to that question. Thank you so much, Brigadier.
Thank you. Thank you for that question, Ronaldo. So, for us to have a sporting event, first of all, we have to be able to confirm that all of the persons who have indicated that they are vaccinated are in fact vaccinated, and that is a part of the authentication system that we're seeking to put in place. I do believe, however, that we do have an opportunity to authenticate the persons who are interested in joining at any one of these sporting events prior to having the authentication system in place, because we do have a very comprehensive database of persons who have already been vaccinated. So once somebody comes with their paper card, we can go through the Ministry of Health system and authenticate those persons who indicate that they are vaccinated prior to them entering any venue that is being made available for whether sport or whatever activity. Now you ask whether or not it has to be limited to sport. No, absolutely not. The same level of authentication that is being used at sporting events can be used wherever else that permission is granted for events to be held. And so I anticipate that once approval is granted for us to be able to take this step into allowing this proof of concept or beyond the proof of concept, then we will be able to successfully authenticate persons and allow only vaccinated persons to access whatever venue it is that has been approved for operation.
So much, Brigadier, for responding to that question from Mr. Renardo Brown of the RJR Gleaner Communication Group, primarily the TVJ sports side. And now let me go to Mr. Jovan Johnson from Gleaner. Jovan, your question, please.
Thank you, Naomi, and good morning to everyone online. Prof. Shirley, what assurances has the task force received from no less than the Prime Minister that these recommendations will not just be paper recommendations, that they will be acted on? And the second question relates to the point when the task force was put in place. What was the state of Jamaica's vaccination rollout that you found, and were you surprised at some of these recommendations which the opposition, members of civil society, and just ordinary Jamaicans were proposing to have been effected?
Thank you. Thank you very much, Jovan. What I can say in respect of your first question, which is the extent to which recommendations will be taken seriously, I think the best response that I can give is that we have already seen the fact that both the Ministry of Health and the Prime Minister have taken into account the recommendations that we have made. You make recommendations, it's not likely that everything that you recommend is going to be taken on board, because they have different perspectives and different responsibilities. But we feel very good so far that many of the things that we have put forward are being acted on at this time. What was the state at rollout? It's an interesting question, Jovan, because as I pointed out earlier, if you look back at the chart that I showed, 6 weeks to 8 weeks ago, we thought that the big problem was vaccine availability. And so we thought that there was a big surplus of persons out there who just get the vaccines out and people are going to be coming out in droves. Now we recognize that that is not the process. That is not the case. And we're having the health system, the Ministry of Health has had to pivot, and we have to go to get carry the vaccination to the people. And so we are in a dynamic environment where we are learning on an ongoing basis. You know, the task force is made up of persons who all have very busy day-to-day jobs, but we are working from morning until evening, early in the morning, at nights and on weekends. I raise that only because no week passes and there isn't a new wrinkle a new twist. The ball is spinning and moving, and we have to be responding. So if you ask me next week, we're going to have different elements because that is the environment that we are in. There is no one single magic bullet, Jovan, that's going to, you implement that and everything is taken care of. It has to be one on that we're acting on multiple fronts on an ongoing basis, and the actions that have to be taken will evolve over time. I hope I've answered your question, Jovan.
Much, Professor Shirley, for the responses there. Again, if members of the media have questions of any member of the task force, you may just use the raise hand feature, and the members will be very happy to respond. I have a question here, just a text in, concerning the authentication system that is being developed. Will it be across the board for both private and public sector in terms of the workings of it? So I believe the individual just wants to know a little bit more in terms of the details on that. And Mr. Peter Milhado will respond there.
Sure, thanks. Yeah, so absolutely, the system is for everybody in the database. So every Jamaican who has been vaccinated, and we have a record for, which is everybody, yes, we would make it available to all citizens. The idea is in the first phase of the rollout, it will be used mostly for domestic purposes, so mostly to authenticate for, like Brigadier spoke about, events. Even some folks may require it for office entry, public buildings, etc., as we've seen overseas. But the second phase is very important as well, which is to allow Jamaicans to travel when we believe what's going to happen is there's going to be a digital regime, if you'd like. So much like your passport has a digital identifier in today's world, similarly when you travel you would have some QR code, something generated with what they call a public key, which is some certifying agency within the government saying, yes, this person has been vaccinated, this is his vaccination record, and we stand behind it. And that would be your access to travel. So even though many countries have announced that after a certain date there will be travel restrictions around vaccination, presently only the EU, the European Union, has started this digital protocol. But we expect over the coming months that many other countries will adopt it as well. So it's really important for Jamaica. We're traveling people. We like to move up and down or on an island. So it's very important we keep pace with the technology and make sure that when that time comes where, to go to the US or to go to Canada, you need this digital certification, we'll be ready for it for all of our citizens. Thank you.
All right, thank you so much, Mr. Milhado, for your response there as well to the authentication question. I see no further hands raised on our Zoom platform, and there I believe then that there are no further questions from members of the media. May I thank every member of the task force for answering the call to national service in the first instance. We thank you so much for that. It's an independent body. As Professor Shirley says, they have regular jobs, but they have had to be working night and day in service to you, our fellow Jamaicans. So thank you so much. And may I also pay a special commendation to Brigadier Lloyd, the JDF at 90%. Very good vaccination rate. Indeed, the blueprint at JDF should certainly be examined as well for that. I see some late entrants coming into while I'm trying to say thank you to wrap up. In the interest, given that this is our first press conference, I will go back. I believe then that Mr. Renardo Brown is indicating, Prof. will allow that he has a follow-up, and so too Mr. Johnson. So we'll allow that. I see no one else with their questions, so we'll just allow those two, and then we'll wrap up. Thank you so much, members of the media. Renardo, again, over to you.
Thanks so much. I won't be a late non-starter in horse racing terms.
You're a sporting man indeed, yes.
As it relates, just a follow-up, the schoolboy football competition is hopefully going to get started in November. As far as the system is concerned, we're looking at maybe about 75 teams. If 20 persons per team, you're looking at maybe 1,500 persons. Why can't that be used? If we're going to have 1,500 persons involved in schoolboy football competition, why can't we get persons inside the national stadium using a similar system for the game next month against the United States? I hope you can answer that question.
Thank you. I'll allow which member, so Brigadier will again take that. May I just make a small point to you though, Renardo? Again, this is the task force. They are independent. They give recommendations. They're not policy driven. Of course, their recommendations would be bumped up to cabinet, and of course the Prime Minister would review those recommendations. So I give that caveat ahead of the Brigadier coming to respond to your question.
Thank you very much, and it is actually a very timely caveat because that's exactly the direction I was planning to head in. The Ministry of Health has to really look at what the risk profile is of these events and make a determination prior to giving authority for them to be held. And so that is really what is going to be the crux of the decision making, whether or not persons can return to the stadium for the US match coming up on the 16th of November. In fact, it is one of the events that we were looking at targeting. But again, as I said, this is something that will have to be determined at the policy level by the Ministry of Health, dependent on what they see our risk profile is and how well they believe that the risk can be managed to allow for this event to take place.
So much, Brigadier. All right, and then let's now go to Javon for his final, and then we can wrap up. Thank you, Javon. Jovan?
Thanks, Naomi. Prof, yes, I'm on. Thanks again, Naomi. Prof, earlier in your response, it sounded as though you were saying that to use the term, take it to the people, was a late starter. That is to say, the localization of that particular approach. Do I understand you to be saying that correctly?
No, not at all. I'm not suggesting that we shouldn't be decentralizing the process of vaccination and going into to every corner of Jamaica to get out the persons who have to be vaccinated. My observation was simply that even as we do that, and even as we also try to get the employed workforce of Jamaica vaccinated so that we can begin to open, we think that all of these things have to be done, but we have to begin to think about opening the economy at a finite time when we can just get back to being more normal. We can't wait until we get there to start thinking about it, Jovan. That's the key point.
Okay. Notice as well you spoke about vaccinate or test. But what's the big difference with saying that there's a mandatory, you're recommending a mandatory vaccination for the public sector?
Well, a mandate basically doesn't give you too many options, but in this case, what we're saying is that every individual has a choice. And as I pointed out, Jovan, we're not just saying that you throw it down as a gauntlet and so on, but that the organizations would make the effort to ensure that every employee understands all the issues and have it explained in terms that they would can understand before they go. And if they still have problems, they can test to come to work to show that they are not vaccinated, so that all the other workers who are at the place of work, as well as the persons with whom they have to interact, are protected. So while they preserve their individual rights, the company or the organization can manage the rights of all the other persons who have to do business. At some point, that has to resolve itself, but there are opportunities for the individual as the process unfolds, Jovan.
Thank you so much.
Just one more thing, Naomi, if you'll allow me. Thanks, Prof. Because in the instance where after a few weeks, as the task force now says that the cost will have to be borne by the worker, what about in instances where the workers refuse to perhaps tender a test? What happens then?
Then I think if they don't tender a test, they won't be allowed to work. Typically, that's the way it works. And their available leave would be deducted or reduced, and it eventually comes to a head in that case, Jovan. I think that's how all of these programs work.
Thank you, Professor. Let's then go to, I see our final hand, Mr. Ainsworth Morris. Ainsworth?
Good morning, everybody. Thanks, Naomi. I have two questions, Professor Shirley. My first question is, should COVID-19 vaccination become mandatory? Should COVID-19 vaccination become mandatory? Would there be a need for vaccination passes for public transportation, public buildings, parks, and beaches, for example?
I thought you were asking, should it be made mandatory? But you're saying, if it is made mandatory, would you need passes for public transport and so on? The issue of those types of mandates, there are a number of countries, for example, many of the European countries have a vaccination process, a process in which, let's say, their public transport, which is quite well organized. You can walk without your mask, for example, if you're vaccinated, from your office to the bus station. But when you get to the bus station, as soon as that bus comes, everybody goes back to the protocols that are required. They, as Peter pointed out earlier, they are quite advanced with their authentication system, and therefore can determine if you're going into the train station underground where the air is recirculated and so on, you would probably have to have your authentication before you can go down to use it. And those things typically are going to be done in a phased basis, becoming more stringent over time, until the requirement is that everybody, to access them, you would have to have all the necessary vaccinations and so on.
Professor Shirley, what kind of manpower would be needed for this to be effective in terms of access points?
I think that really relates to the design of the system. I think the reality is that we can't say we have done a design for all of that and looked at that in the period that we have been working at it. But there would be some resources required to do so. But we have to look at those resources relative to the implication of the economy remaining closed and shut down. We have to look at it in the context of losing place in many of the industries in which we compete. We would have to look at it in the context of our children going uneducated. We'd have to look at it in the context of the lives of persons who are putting their lives on the line, being lost because of our inability to protect ourselves against it. So we have to do that, the trading off to ensure that we understand why it is that this would be necessary.
Final question, Professor. What is the preliminary budget for the digital vaccination card in terms of development and maintenance?
Peter?
So I'm pleased to report that the software and the integration process is actually free, in that it's open source, and eGov exports, if you'd like, software as a public good. So there's no actual cost to the software platform. However, there are obviously going to be implementation costs. UNICEF has been a tremendous partner, and they're going to pay for a number of the implementation costs that we face. But we will have to do some internal capacity building to make sure that when we hand over the handover the system from eGov to the government of Jamaica takes place, that we will have competent people in place to run it. But as Prof said, I think that investment would have to be seen kind of in the calculus of, what does this afford us? What opportunities does this afford us to have a proper authentication system versus not? And look at that. But the cost is really manageable that we're getting. Thank you.
All right, I think then that has brought us to an end. Once again, may I thank members of the task force. In closing, I'd say this to our Jamaican friends or family members, that this is a public health crisis. Many of us say it's never been faced within generations. I think what is required is patience and certainly an approach that involves everyone. The task force, I know, based on Professor Shirley's presentation, is committed to getting it right, to making the right recommendations, and certainly to assist Jamaica in getting out of this ahead. A main component, and I say this with respect, is that we have to get our children back to learning. The learning loss is significant. And so if we love our children, we'll get on board to try to get this thing done right. Thank you so much for joining us. May I remind you of the task force members chaired by Professor Gordon Shirley. Mr. Dunstan Bryan also joined us on our Zoom platform, the Permanent Secretary in the Ministry of Health and Wellness, along with Dr. Jacqueline Bisesa-McKenzie, the Chief Medical Officer in the Ministry of Health and Wellness, Dr. Sheila Campbell-Forrester, the former Chief Medical Officer and now Adolescent Health Specialist, joined us online. Professor Lloyd Waller as well joined us online. He is a Transformation Policy and Governance Professor at the University of the West Indies, Mona, as well as Brigadier Markland Lloyd of the Jamaica Defence Force, Mr. Peter Melhado, President and CEO of the ICD Group, and of course Mr. Alok Jan, consultant here at the Office of the Prime Minister. Thank you so much for joining us for this inaugural press conference from the task force. Independent they are, so you will see them all over, and certainly when next they have a press conference or speak to you in whatever platform, please give them a listening ear and make your suggestions. You know, we're always very opinionated in Jamaica. Make your suggestions and we'll take it on board for sure. Thank you so much for joining us, and see you again next time. Take good care. Good morning and good day.